friends. Welcome to the Putting You Back Together Again show. I'm Rochelle Booker, aka Coach Ro. Well, happy New Year to you. Well, at the beginning of the year, thousands, if not millions of people embark on a new journey. Yes, setting that New Year's resolution. Well, I'm coming into your home to talk to you about how I can help you plan your New Year's resolution. And I want to be a part of your planning process. Yep, you got it right, because your health and fitness has to be a priority. And so that's why my panelists are here with me today to talk about a very important topic. The overarching message of my show is to empower and inspire you to build a better future. And that's much of my focus is on health and wellness. I want to encourage you to take control of your life and prioritize your health, because without good health, it's tough to have a qualitative life and an abundant life that God wants us to experience. We have to choose life and be vigilant about our health and fitness holistically. Today's show is about breast cancer awareness and debunking the myths that so many people hold on to, including myself. There are two very important and special guests with us today who are going to help us do just that, to put everything into perspective. So I just wanted to let you guys know of what we're going to be talking about. And I'm going to introduce my guests. And my first guest sitting to the right of me is Dr. Robinson.
Yes.
Hi, Dr. Robinson. How are you?
I'm wonderful. Thank you for having me.
Well, thank you for being here. And just real quickly, tell me about why you decided to jump into this field, medical field, and in particular radiology.
So I went into medicine. My mother actually had a chronic disease. She had a myotonic dystrophy, which is a form of muscular dystrophy.
Mhm.
So she was in and out of physician offices quite a bit when I was growing up, and I'm an only child. So I think that inspired my dream of becoming a physician, seeing how those physicians impacted her life.
Oh, wow.
Now, radiology specifically, it was something that it was a kind of a turn of events,
Mhm.
but the long story short is I ended up in radiology. This is throughout my medical school training.
Uh-huh.
I thought I was going to be a surgeon.
Mhm.
I thought I was going to be an orthopedic
Oh,
surgeon,
really?
actually. Yes, and I'm very happy. Thank you to the orthopedic surgeons out there, but I am very thankful that I am a breast radiologist.
Yes, and so are we.
Yes.
And if you notice, and thank you for putting her name up there, the first 5 letters of your name is Angel. So
Yes.
you are definitely a heaven sent from God. Yes.
Oh, well, thank you.
Yes, helping people to overcome and fight this insidious disease. So welcome.
Thank you.
And our next special guest sitting to the left of me is Miss Chandra G.
Mhm.
Welcome, Miss Chandra.
Thank you for having me.
Thank you. And she is a breast cancer survivor.
Yes, I am.
So, and we just got to open this up. We've got to just talk real quickly before you jump into your story, because I'm going to ask Dr. Robinson some questions first. Let's talk about how we met, because it was providential. So we both go to the same church, Wheeler Avenue, and we had a Prime of Life event, gala.
Yes.
And at the gala, we had a donation where it's like a silent auction donation. And so part of what I gave was an interview for my show, an hour-long interview on the radio show. And so she was the one who won.
I won some auction.
Yeah.
So I'm like, what is bidding on this?
Right.
It's a great opportunity.
Right.
Like, yeah.
Well, and so when we connected, I thought that she was going to talk about her business as an entrepreneur. I said, okay, what kind of business do you do? I want to help you promote it. She's like, no, I'm not talking about my business. I'm talking about my life, my breast cancer experience and journey. So, and I was looking for a doctor and a survivor. So this was providential. Good timing. Yeah. Okay. So let's talk about the evolution of breast cancer. And are there any known causes of it? If so, what is it?
So we know that breast cancer, it's multifactorial. So there are an array of causes. With that being said, we do know that there is an increased risk of breast cancer for people who smoke. We know that there is an increased risk of breast cancer with excessive alcohol use. I don't make the rules on what is called excessive. let me say that. But if over 2 drinks per week is considered excessive in terms of increasing the risk of breast cancer.
2 per week, not per day.
But yeah,
What?
Yeah. So alcohol it's not the best for you.
That's excessive. Well, I am a wine connoisseur, and so should I just stop drinking completely, or just in moderation?
No, and again, that's a slightly increased risk. So it's not saying. And so with that being said, there can be patients who end up with breast cancer who don't drink at all.
Oh, gotcha.
And there are people who smoke who never get breast cancer.
That's true. Or lung cancer.
Or lung cancer for that reason, for that fact. But those are risk factors that we know about. We also know that about 10% of breast cancers have a genetic component. So we know that, again, approximately 90% of breast cancers, patients are going to be the first person in their family to be diagnosed with breast cancer. So they didn't have, where their mother or a first degree relative, which would be mother, daughter, or sister, was diagnosed. But approximately 10%, there's a definite genetic component. So if you think about examples, like, for example, Angelina Jolie, I am not her official physician, but she did, let people know that she had a prophylactic. She decided to have a double mastectomy, even though she did not have breast cancer. So typically, patients that do that have a strong component. There are certain genes that they may have that increase their risk of breast cancer.
Oh, wow. And just going back real quickly, because I read something about alcohol consumption, and it said that, sorry, I got to stay on that for a minute. I'm just telling you, because it's conflicting information. And the article I read was research about drinking red wine is good for your heart. So is that still true, or?
Well, I'm not a cardiologist. I'm a breast radiologist. And again, the alcohol component. So can people still have a few drinks? Absolutely. But does that mean you're going to get breast cancer? No, it doesn't. But there is a slightly increased risk.
I got it. Okay.
But we also know that you can decrease your risk of breast cancer by doing regular exercise.
Well, yeah, that's right. But see, to that point, because we're going to get to that, because there are healthy people who have gotten diagnosed. So it's just, there's no guarantee.
That's correct.
Yeah, but you're right. It does increase it if you do certain activities like drinking and maybe even affecting smoking. And does it affect fertility as well? When you get breast cancer, does that affect your fertility?
Well, it's typically the treatments for breast cancer that can affect fertility.
Oh, wow. My goodness. And what about environmental justice? Because environmentalists talk about, clean air, clean water. So, and we see a lot of impoverished neighborhoods, especially with people of color living in different demographic areas that, with pollution, waste, there's issues with waste management. Do you think that affects it as well? Or exacerbates it?
It's possible, but we don't know that.
Gotcha.
Yeah, so far the science hasn't shown that. And again, depending on, even with the alcohol, she's like, so
touchy subject.
Exactly, it is. And depending on which study you read, so some studies may say, oh, well, you can have 3 drinks a week. Some may say 4 drinks a week, but a safe, a safe number would be. And let's not forget, alcohol affects other things.
That's your liver.
Yes. So it affects other things in the body as well. But I do want to hasten to say that it is not a patient's fault if they get breast cancer. So it is just so imperative that we make sure that dialogue is very clear.
Yeah.
So a patient can do everything right and still get breast cancer.
And still get it.
So she can exercise, she can not drink, she can have no one in her family had it, she can be young, she can, you can check all the boxes and you can still get breast cancer. So I think the most important thing that patients need to remember, and what I really try to make sure that my patients know, this is not your fault.
Yeah.
This is just, unfortunately, something that happens, but it absolutely is not your fault.
And let's talk a little bit about that. because you
Yes.
are a survivor.
I am.
So when you rung that bell, did you sing Destiny Child's song, I am a survivor?
I think I was more crying than I was.
But when you told me your story, I cried.
Yeah.
I was like, oh my gosh. So how did you feel? Did you feel that it was your fault, or did you could have done something differently? Hindsight's 2020. Do you feel you did something that kind of brought it on, or what?
I
What
knew
was
during
your
that time I
experience?
was stressed a lot.
Oh, really?
Work, it was a lot of stress going on in my life during that time. It was a company that I was having in my life. There was a
Oh.
advocate to that stress.
Oh.
So I believe that has something to do
with
because
it.
I'm not an avid drinker nor a smoker, but I do have a little cocktail every now and then.
In moderation.
Right.
Y'all heard that? Moderation. You don't have to stop drinking.
Right, I'm a social drinker.
You're social, there
Yes,
you
I'm
go.
a social drinker. So I'm like, and I was, my health, in terms of eating and food, I wasn't like a bad eater of diet. I didn't have things like that. I did work out, not like I do now, but I did exercise a lot,
Yeah,
but
right.
I didn't know where it came from. I was just so scared and worried, but I did have a little discharge every now and then. Like I would notice little things,
Oh.
but it was like years ago. Like
in both breasts?
just one.
Just one breast. Oh.
Just one, and then it was after I had my daughter. But after that, I didn't have that symptom anymore.
Right. Oh, wow. And see, you were relatively healthy. Now back to risk factors. You weren't high risk because you didn't have it in your family. There's no family history.
No, there's no family
See,
history.
that's one of the myths we're going to talk about.
Mhm.
Right?
Absolutely.
Yeah, yeah. So what went through your mind when you were told by your doctor, it's cancer, it's not benign, it's malignant?
Right. So what going back to when it all started, I was just, I do regular birth exams on myself in the shower or in the bed.
Self-care.
I always do that. I
That's
still do
awesome.
to this day. And I felt something. I said, oh my God, this is like weird. But I know how it feels. Like, I felt it before. Like, when I was in nursing school, I felt it before. So I was like, oh my God, this feels like what I felt in the little mannequin in nursing school. So my friend was there. I was like, hey, feel this and see if you feel something. And she's like, yeah, I feel that. And I was like, oh my God, it may be something. Like, stop worrying about it. Like, you're stressing yourself out. Just calm down and go to the doctor. So I went to the doctor on December, I can't remember the exact date of the day I went to the doctor, and I got the exam and all that, the biopsy. And then I was talking to people that were breast cancer survivors prior to me going to the doctor. Maybe I shouldn't probably have done that, but I was talking to them prior. And they said, well, you're going to know if you have it because they're going to do one or two things. They're going to give you a call and they're going to say, come in.
Come back in.
Or they're going to send you like something in an email and say, all is great, it's benign. If you get that call, that's something. And so on December 23rd, I got the call in 2019.
That you were dreading.
Right.
Yeah.
And he was like, Miss G, we need you to come into the office. Doctor want to see you.
Goodness.
And for some further testing. I was like, well, can you tell me over the phone? She was like, no, we need you to come in. I was like,
you want it over the phone.
I knew exactly what it was. So I said, well, when do you want me to come? She said, can you come tomorrow? I said, tomorrow is Christmas Eve.
The urgency, you knew.
And so she was like, I know, we're open. So I came, I went to the doctor's office on Christmas Eve, and it came back that I had breast cancer.
Oh, goodness.
And it was just like, it was just crazy. I was just like, are you sure that's right? Are you need to be tested? She's like, no, I'm sure. Wow. I was like, but there's no signs of my family. And I was like, I'm practically healthy. I'm like, I was just calling all these things out. And she said, Miss G, you have breast cancer.
Wow.
And this is what you need to do next and go from there. So hearing that, it was, and I was by myself too. So
that's right. You told me that. Is that, we're going to get back to you. Is that a sense of denial that most patients have? Like they're not receiving that?
I have been in that situation. I often patients have
hold on. Okay. Hi, caller. This is the Putting You Back Together Again show. Thanks for calling. Who are we talking to?
They hung up for some reason. Want me to call them back?
No, don't call back. They hung up. Go ahead.
So can you repeat the question?
Oh, yeah. So I was talking about have you had patients that felt like they were in denial when you gave them the bad news that it's cancer?
Sometimes yes.
Uh-huh.
So there's an array of reactions.
Yes.
Some patients are very calm. Some patients are not very calm. With that being said, I 100% understand anything in the spectrum. You know, this is not typical news. And I believe sometimes I get the feeling that some patients look at it kind of like going to the dentist, in the sense of, you know, I'm going to get the mammogram, check the box.
Gotcha.
Okay, now I'm going to the next thing. So when you stop them and say, actually, there's something, they're shocked. Well, what do you mean there's something? Or the next thing that I often hear is, well, I mean, I come every year and there's never been anything. Why would there be something now? And so I have to say, well, then the mammogram did its job. That's the point.
Yeah.
We are seeing a change. So it worked. This is what is supposed to happen if there is a change.
Gotcha.
But the sense of denial, I mean, no human is ready to hear that their life is going to forever change.
Yeah.
And I'm very cognizant of the fact that I am the last thing that stands between a patient and being cancer free.
Yeah.
Because from the moment I say, I'm so sorry, but this is breast cancer, I realize that their life is going to be forever changed.
Yeah.
So I'm very thoughtful of that, and I'm very careful with those words, because I realize that I am participating in a very life-altering moment for patients.
Yeah.
And it's new. It's your first time, or even if it's a recurrence, it's they can't believe that this is happening.
Right.
So there is a sense of denial, because we just don't want to think that could happen.
Yeah, we don't.
And the younger you are, you know,
That's
you don't have to say your age,
young.
but I'm just saying you look
You
pretty
can
young.
tell.
Yes.
You're like, 20, girl.
Yeah. You look pretty young.
Oh, my goodness.
And so the younger a patient is, it's even more, well, how could this be? I will tell you, in my practice over the years, so I have been in clinical practice as a breast imaging radiologist for 14 years. And the youngest patient that I have personally diagnosed was a 21-year-old college student.
Oh, you're kidding.
She was a 21-year-old college student.
My
So
goodness. Just devastating.
And so I did the same thing you did, except I called pathology and said, "Are you sure?
Right.
Like, are you positive? Are we
Yeah.
positive?" So it can happen.
And especially if you feel good, you feel vibrant, you feel strong and healthy, and all of a sudden, no, this is wrong. Because you've heard of cases where patients have been misdiagnosed. Maybe not so much in breast cancer, but I've read other cases or articles where other patients have gotten misdiagnosed about other stuff. So, yeah. But so you mentioned in our conversation that it was like very aggressive type of cancer.
Yes.
Describe
It was
that.
triple negative.
Triple
which
negative.
is the worst kind there is.
Triple negative. So there's a double negative and single negative. Like what? Oh goodness.
Yeah.
So does that mean it like metastasized?
It was
or-
very aggressive.
Oh goodness, just moving all over the place.
Yeah. As I know, it's not caused by hormones. I don't know how it's caused. They're still researching that. So that was another thing too as well. Like I was getting paid to take surveys for a long time, because like I was so young when I was diagnosed, and the type of breast cancer that I had, they like, we want to, continue like different types of samples and testing on you, actually use questionnaires to see if we can figure out where the cancer is stemming from.
Oh, that's how that works. Wow. And so what type of treatment did you, other than that, did you do any other type of radiation?
Oh yeah, I did a
chemo and
little
chemo and all that.
So
Okay.
I did chemo from February to like July.
Oh, okay.
And from there, I had surgery. I was thankfully, to keep my breasts.
Oh, good.
I actually got like a little breast lift.
Oh, girl.
All kind of stuff.
Oh, wow. Blessing in disguise.
So they're like, they wanted to save the breast.
You don't need to push your bra now.
Yes, so that was a good thing. And then I went through radiation, and that was, woo.
Your
And then
hair. Yeah.
So I did lose my hair, and that was the thing I did not want to lose. I said, "Can you just take the breast? I really want to keep my
You'd
hair."
rather keep your hair than your breast?
It was so big and full and long.
Girl, you gotta put a wig on.
Because I wanted to keep my hair. But so no, I was able to keep my breast. I did lose my hair, but it all grew back.
Take me back.
After radiation, I went through another round of chemo.
Goodness.
It was a pill supplement
Oh.
for about
okay.
6 months.
And you were pretty much by yourself. That's what makes it
Yeah.
so powerful.
Mhm.
You didn't have a big
No.
network of a family helping you and
Right.
supporting
I
you.
couldn't have that. And yeah, they didn't. The doctors did not want people around me. When I was patient MD Anderson, and they moved me from downtown the Woodlands. Yeah.
Oh, COVID. You were.
Yeah.
That's right.
COVID. Yeah.
And they moved me from downtown to Poland.
Hi, caller. Can you hear us?
Yeah.
Turn down your volume in the back.
And they moved me from downtown to Poland.
Yeah, can't hear you.
Turn down your volume in the back.
There's a lot of feedback. Yeah, I think we have a bad connection.
Are you there, caller?
Can you hear us? Yeah, I don't know what happened there. Okay, so sorry about that, but yeah. So so you went through the treatments and you were pretty much by yourself, yeah.
Mhm.
And so many people, I'm sure, face that same type of dilemma of being on their own. They're like, what do I do next? And we're going to get into more about the resources that are available a little bit later at the end of the show. But one of the things I wanted to ask, because this is a good segue to my next question about mental health. Like, how did you manage your mental health?
Prayer.
Prayer.
I
I know,
was-
that's right.
I prayed a lot and I meditated.
Yeah.
I watched positive things. I always surround myself with positive people.
Yeah.
If it wasn't something that to uplift me and inspire me, I really didn't, associate myself.
Okay, hopefully it's coming. Hi, caller. Thank you for calling into the show. Who are we talking to?
This is Karen Rose.
Hi, Karen. How are you?
I'm doing great. How you doing?
Thank you, ma'am. We're doing well as well. Thank you for calling to the show. What's on your mind?
Hi, Dr. Robinson.
Hi, Karen. I know her. So
Oh.
Karen is a breast cancer survivor
All
who also has
right.
an amazing story. But
Oh,
I'm not going to take her limelight. And she runs a wonderful breast cancer organization in Galveston County, My Sister's Keeper, where she reaches back to others who have been diagnosed with breast cancer. So, Karen, what can we do for you? Thank you for tuning in.
Yes, thank you.
Well, what I wanted to do is high five the survivor, because I also went through triple negative breast cancer, and my breast cancer was stage 1 with no lymph nodes involvement, and I did go 4 rounds of chemo. And I just want to say kudos to you. I know exactly what you went through, how you went through it, and all that stuff. And I just say, you're amazing and you look wonderful.
Thank you.
She doesn't look like what
You
she's
too.
been through.
Thank you.
And I'll tell you guys don't know Karen, but she looks amazing as well.
Oh, wow. Two amazing,
Karen.
phenomenal women. Yes. So, Karen, did you have any history of that in your family, or were you the first one diagnosed?
Yes, it was on my father's side, which is rare. My grandmother had apparently probably was triple negative as well, because as a young woman, the doctors told my sisters and I at UTMB that my grandmother had one of the worst cancers that a woman can have, and to make sure that we got our mammograms on time. And I had just gotten a mammogram like 6 months before I had gotten married. I am going into my 21st year survival.
Oh, wow.
February 6th will be 21 years.
Ooh, right.
And I had just married my husband.
Really?
6 months until, I got cancer 6 months, but we stuck it out. We still married, just celebrated our 21st year anniversary. And I had a mammogram like 6 months prior, and the mammogram did not pick it up. So it was the Spirit of the Lord that woke me up and said, wake up, you have a lump in your breast. So I put my hand on the sternum, but it didn't go in the sternum, but it was on the sternum. I got up and went to the restroom, and I heard another voice say, you're going to go through, but you're going to be fine. So I had to take action with that. Me, I'm a very nosy person. Angel will tell you I'm inquisitive. I want to know everything, what's going on with my body. And I went to the doctor, and sure enough, in 6 days, she called me and told me to get to MD Anderson, but I didn't go to MD Anderson. I did mine through right here locally. It was locally at home. So I just tell people, you just have to know your doctors,
Yeah.
and you have to do a lot of research, and you got to read, and you can't be slow up on this here thing, and just learn more about your body, and I chose to have a mastectomy done
Hmm.
because it was really going to be aggressive, and my grandmother had it, so I didn't want to take chances. I wanted my doctor Beverly Lewis to take both of them, but she says she don't believe uh, taking anything that's not broken. So, but however, I had a reconstructive surgery, and they got me looking all good up here. Got the girls right. So I'm all good. It's been 21 years, and I'm here to tell anybody you can live with this thing, but you got to have a positive attitude.
Yes, that's
Yeah,
exactly right. Positivity, positive affirmations, and be surrounded by supportive, positive people. To your point.
right. I had a very supportive family. They was there all the way through and still here. So, I heard Dr. Angel tell you about the 501c3 that we have now. We do a love brunch where we serenade the ones that's going through, and in memory of the ones that has lost their battle. And we also have a walk that we do in April. And I was listening at the young lady saying about December that when she was diagnosed, well, my doctor told me, she said, you can have a walk at any time. It doesn't have to be in October because patients are diagnosed from January to December. It doesn't stop because it's a holiday.
That's true.
It just goes on and on and on. So we're going to be having a walk here in October, and I just hope that I can get a lot of people to come and join us.
Yes, yes. Well, I definitely want to do that.
Well, thank you for calling, Karen.
Yes.
I sent the link to some people, so Karen definitely paid attention.
Yes, you paid attention.
Well, I wanted to support Dr. Robinson because she always support me, and she's a member. We're a member at the same church,
All right.
and then she's always very supportive to her in the community. So everything is really, really good with her. And I just thank you, ladies, for doing what you're doing.
Thank
you.
you. Beautiful story. Thank you.
Okay,
God bless you.
you're welcome. You're welcome.
Oh,
Bye bye.
Jill, did I call you Angel? I told you.
Well, and I wanted to speak to both of you mentioned triple negative. So if you don't mind,
Yes, please
I would love
explain
to
it.
just give a basic overview
Yes.
explanation for the people out there who are like, I have no idea what they're saying. So the best way to explain it that I have found is this. So remember, well, depending on your age, but my age, when we were growing up, there were those big TVs, even, or maybe at your grandmother's house, and they were the big brown TVs, right? And they had antennas, right? And they had antennas, right? And the antennas reach up, and then you're telling your cousin, "Hey, wait, move over." So we gotta get this. Hey, move the antenna, right?
Get the signal.
Yeah, we gotta get the signal. We gotta get the signal. So what I want you to do is think about the television. Let's pretend that that is a cell, okay? A cell that's in the body. And we're going to pretend that those antennas, that's a receptor. We're going to just say the word receptor for that. So there are 3 receptors that they're often looking at. The estrogen receptor, so that's ER. The progesterone receptor, that's PR. And there's one that they call HER2/neu. Now, the overview is that if your cancer has the antenna, if it has the receptors, then we call that positive. So if it has the estrogen receptor, that's ER positive. If it has the progesterone receptor, that's PR positive.
Okay.
And then you can be HER2 positive. So if you have all 3, that's triple positive. So why does that matter? Well, because that means that the medicines that we have to treat it can latch on. Those antenna or receptors can latch on to the medicine, right?
Yeah.
So if you don't have those receptors, if you're triple negative, that means the medicines we currently have are not going to work as effectively. Does that make sense?
Yes.
Yeah.
So that is the overview of when people say, and we know from the research that African American women are more likely to be diagnosed with triple negative breast cancer. And we know that triple negative can be more aggressive. But I don't want anyone to lose hope. And I think Karen calling in is a perfect example. She was diagnosed with triple negative breast cancer, and she's a 21-year survivor.
Yes. Praise God. Nobody but God.
So this is, so we, you know, it's not, breast cancer is not the end of the story.
That's right.
That is not the end of your story. It's just a new chapter.
It is.
It's just a new chapter. And I get it. It's a chapter that often you don't want.
Right.
And, but it's just a new chapter. It's not the end of the story.
Thank you for that
Thank you.
clarification. Because I was like, triple, what? Double, triple. Okay. Did we get a chat? Looks like we got a, I think someone was
Yes,
Leah
ma'am.
Harris.
Yes, ma'am. We
That's
have.
Is that your?
That's
Oh, yeah. Okay. Hi, caller. Thank you for calling into the show. Who are we talking to?
Sharon Thibodeau.
Well, hi, Miss Thibodeau. How are you doing? Can you hear me?
I can hear you.
You've got a little
I'm
bit.
doing good, and you?
Fine, thank you. You've got a little bit of background noise. Can you turn it down a little bit? We want to make sure we hear your question. We can answer it appropriately. There's a little bit of background noise there. Are you there?
Can you hear me now?
Yes, ma'am. That's better. Thank you. Well, what's on your mind?
Well, I like to do a shout out to Dr. Angel Robinson. I would like to give a shout out to Dr. Angel Robinson.
All right.
She diagnosed me 1 year ago, October 2023. I had stage 4 bilateral breast cancer.
Oh my gosh, bilateral. That's a new. Wow. And what year was that? When was
October 23.
Oh wow. So just recently.
So how
Yeah, just recently.
how are
So
you?
therefore, I'm cancer free. I was diagnosed cancer free in September.
These praise reports. So we're
Yes.
giving people hope and encouragement and inspiration through this. Oh my gosh, I love it.
Yes,
So
yes.
now, did you have history in your family as well, or were you the first one to get it?
I'm the first one to get it. I was age 59.
Really? My goodness.
Yeah, I was age 59. So therefore, I was the first one. And Dr. Robinson, she went out of her way when she did her ultrasound. She went out of her way to do the extra. I did the mammogram. They couldn't locate nothing through the mammogram. So Dr. Robinson went and did extra when she did her ultrasound, and that's when they located my cancer.
Oh, right. That's what I'm talking about. All right.
You're so
Oh,
sweet.
So I praise God today.
Miss Thibodeau, hold on a second. We have another caller coming in. Hold on for a second. We'll be right back to you. Hi, caller. Thank you for calling into the show. Who are we talking to? Are you there? Okay, maybe there's a bad connection. Okay, let's flip back over.
Hello?
Oh, can you hear us? Hello?
Yes, can y'all hear me?
It's a little bit of static. What's your question?
Hello?
Okay, yeah, we can hear you.
Oh, hi, how you doing?
We're doing well. How are you? What's on your
Good.
mind?
I was just tuning in and listening to you guys talk about the subject. I had one question though. I just wanted to ask. I wanted to know, like if y'all could give a little bit more description or like detail as far as how the virus, gets started and like formed in your body. Like, is there something specific that triggers it, or as far as foods that we eat?
Good question. Thank you.
Yeah, so that's a great question. So thank you for calling in with that question. So there's not one specific cause of breast cancer. We call multifactorial, and that means that there are a lot of different things that may contribute. So there are cells in all human bodies that grow and then die, and grow and then die. Think about your hair or your nails. But what happens in cancer is that the cell does not get the sign that you're supposed to stop growing. So instead, it just keeps going and going and going. And that is what cancer is. Instead of dying, those cells just keep going and going and going. But it's nothing that, as we discussed earlier, it's nothing that any patient did wrong. It often is not linked to a specific cause. Most patients were the first patient in their family to be diagnosed with breast cancer. So we just have to, the best thing that you can do is start getting your annual mammogram starting at the age of 40. And if you're having a breast issue, even if you're younger than 40, making sure that you get that taken care of. That would be, you talk to your primary care physician, they would refer you to a breast imaging radiologist. That's what I do. We also work with our colleagues in breast surgery, medical oncology, radiation oncology, but making sure we're addressing if there is an issue.
Oh, thank you for that. That was very enlightening.
Okay, thank you.
Okay, thank you,
Thank
Paula.
you. I just wanted to ask.
Thank you. All right.
Yes, thank you.
Take care. Yeah, wow, that was very interesting. Did we lose Miss Thibodeau? I think she might have.
Yes,
yeah, she
please
might be
encourage her to call back if
Oh.
she's still watching.
Yeah, that was no. I love her story.
Well, shout out to you, Ms.
Yes.
Thibodeau. Thank you for listening in. That's
yes,
wonderful.
we appreciate that. So now let's talk about. I mean, we talked about some of the myths. In fact, that was one of the questions. About is there, if you have family history or don't have family history. Of course, it doesn't matter. You just clarified that. So getting that baseline, and you said 40. Doesn't matter if you have family.
So if you have an average, some people would.
Oh, really? Blowing up. Caller, thank you for calling into the show. Who are we talking to?
Hi, this is Donna.
Hi, Donna. How are you doing?
I'm good. I am also a cancer survivor,
Oh,
breast cancer survivor.
Yes. Was Miss Dr. Robinson your doctor?
He was not my doctor. He was actually in my Bible study, but she gave me a lot of information. I do know Dr. Robinson, but I wanted to give some advice based on conversations with Dr. Robinson. You see, people can see how well she explains what's going on with the body and how cancer works. And I just want to encourage other women who may see a doctor and they're not getting that kind of care, where the doctor is not explaining enough for them to really understand and make a decision. It's a tough decision, and I have a very strong history of breast cancer, so I knew a lot about what to expect. But still, when it hits you, and it comes into your space, it's a different thing.
It's a different.
And so, yeah, and so I even had to change doctors, and I encourage other people, if you're not getting the information or feel that you're not being heard, that's very important during this time.
Yeah.
And to clarify, she didn't change away from.
No, I did not.
I know her socially.
No, I'm just saying Dr. Robinson is a good example. And if you have breast cancer and you're seeing a doctor that is not explaining things to the degree that you need, like Dr. Robinson is showing you right here, then you need to see someone else.
Yeah, great point. Because you want someone to care about your progress, about your livelihood. Yeah. No, thank you for that.
That's great.
That's great.
Good.
Yeah.
Thank you for the support, Donna.
Yes, I know that's right. All right, take care.
Okay, bye-bye.
Bye-bye. Wow. Well, your phone's going to be blowing up with new appointment, girl.
Yes.
Oh my gosh, she's not going to be able to handle all that volume. Oh, wow.
Well, and let me also say, I work at University of Texas Medical Branch, which is based in Galveston, but we have locations in League City, Alvin, and Galveston. I also have wonderful breast imaging colleagues. So I'm not the only breast imager there. I'm the director of breast imaging. We have a total of 6 breast imaging radiologists. And all of my colleagues are wonderful. So I just want to make sure I say that. I have a great team. So without a great team, we can't make any of this
That's
happen.
true. That's true. But they're gonna want to call you. They should. I know that's right. We gotta have her. We gotta have her. So let's talk a little bit more about the symptoms, because like I told you, I think on our call that I had 2 shows on prostate cancer, and that's a very insidious disease. I mean, stage 4, and it happens so quickly. You don't feel a thing. So is it similar? And you said you had a little bit of discharge. You said.
But that was years ago.
Oh,
right?
that was okay.
Yeah, so I could just think of something, and it could be pertaining to. I would say that, but I wasn't even at 40.
Wow.
Just
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 a routine exam.
Yeah.
So yeah, but you said if there's pain.
So, and I like that.
Yeah.
I love your story, and I like that you're highlighting that. So another myth that we need to debunk is that breast cancer is painful. Over 90% of the time, it's painless.
Less.
So typically, even if the patient feels something, it's not going to hurt. So sometimes people have felt something, and they say, well, Dr. Robinson, I felt this, but I didn't come in because it doesn't hurt. And I think, oh no, oh no. So now, is that all the time? No, but 90% of the time, approximately, breast cancer is painless. Other symptoms, though, or signs that patients can have, when you mention discharge, we're a teaching institution. Mm-hmm. So we train the next generation of medical students and residents and fellows. And what we explain to them is it's the 4 S's. That's what we get concerned about in terms of breast discharge. Mm-hmm. So if it's coming from a single breast, if it's coming from a single duct in the breast, so meaning if you were to look at the nipple, it's just one small area that it's coming out of the nipple. Is it coming out on its own, or is it spontaneous? And is it what we call serosanguinous? So is it clear, or is it bright red like blood? Oh, so goodness. Those 4 S's, or the more of those that you have, the more concerned we are about breast discharge. So breast discharge, or you're feeling something new, or you're having pain, or you're looking in the mirror and notice, is my skin changing here? Oh. So those would be things that are concerning with breast cancer. Wow. But with that being said, you can have none of those symptoms, which is also why we encourage patients to get the screening mammogram. Yeah. The goal, and you weren't old enough. I mean, you weren't even of the age to have a screening mammogram.
So you never even thought about it, never crossed your mind.
And you weren't supposed to be getting them. Yeah, you weren't supposed to be getting them. So, but the point being, if someone is younger than the age where we typically start mammograms, which is 40 for most patients, if someone is younger than that, then if they are having a problem, they need to come in. So that's it. We really shouldn't be telling any young women, oh, well, you're so young, don't worry about it. We also shouldn't say, oh, well, I'm sure it's just a cyst. I had cyst, your mom had cyst, don't worry about it. What we should say is, why don't we get this checked out? Most of the time, it's not breast cancer. It's true. So that's what patients ask me when we do biopsies. They say, well, I mean, what else could it be? And I say, well, you know what, believe it or not, there are about 20 diagnoses you can have in the breast. Really? There are a lot of big words that our colleagues in pathology look under the microscope and tell us. And there's a lot of big words that they give, but there's 19 approximately that are not cancer. Okay. And it could be one of those 19 things. Yeah. But if it is cancer, we just help you take the next step in your journey.
Those pesky cysts. It's all over the place. Most are benign, so praise God. Yeah. What about tenderness? Can they be really tender too if you have it, or that could just be anything?
So typically cysts can be, and when we say cyst, let's clarify, we are saying something that is fluid filled. So let's think of a cyst like a water balloon. Okay, a cyst. And why do we get cysts? Those are just normal changes that can happen in the breast. Gotcha. So it's just something that can happen that's not concerning. Okay. Versus a mass, we're saying something that is solid, like a ball.
Tumor.
So
Yeah.
a tumor.
Ugh.
So it's something fluid
Gotcha,
filled,
gotcha.
which would be a cyst, which is typically not worrisome,
Okay.
or is something solid. But just from feeling the breast, we often can't tell
Gotcha.
one or the other.
Okay.
So Ms. Thibodeau, who called in, she was great. She mentioned ultrasound. So often we're going to need to do additional studies, a breast ultrasound, to know if it's fluid filled or if it's solid.
Solid. Yeah, and that's what happened to me because I went in for my initial exam, but my breast tissue is very dense. So the dense tissue, they're like, oh, you got to come back in. That call scared me.
Yeah.
I was like, oh, you got to be kidding. It wasn't near Christmas, but still, it's just I didn't want to hear it. I'm like, oh my gosh, and so I had to come back in, like, and that was scary. Yeah. Oh, another caller? Yeah. Hi, caller. You're calling into the show. Who are we talking to?
Hi, this is Chanel.
How are you doing?
Good.
What's on your mind?
Sorry. Can you hear me? Because I'm kind of in the car.
Yeah, we can hear you.
Okay, cool.
What's your question for us?
Okay, yeah. So I joined in a little late, so I'm not sure if y'all already discussed this, but I know one of the things that's like a myth is breast cancer, necessarily it doesn't have to run in your family. So what are some, outside of just getting your annual checkup, like what are some things that you suggest we check, amongst ourselves throughout the year just to see, if there's anything concerning that we should go to the doctor before our annual exam?
Great question.
We like to promote what we're calling now breast self-awareness. So what does that mean? It means you need to be comfortable with your body and know if there's a change. So we're saying for years, you need to do breast self-exam. And what they found is sometimes patients thought they felt something that wasn't something, or this or that, and then they got confused. Well, do I do it at the beginning of the month, at the end of the month, or do I do it both times of the month? Which is confusing for patients. So if you notice a change, that's important. We talked about annual screening mammograms if you're 40 and above for most patients. We talked about, again, if there's an acute finding, even if Karen spoke about, she had a mammogram. It wasn't with us. I did not diagnose Karen. I know Karen. So she had a mammogram, and she said in 6 months later, then she felt something. So we know from scientific studies that approximately 10% of mammograms of breast cancers are mammographically occult, meaning they're not necessarily going to show up on a mammogram. That's also something to keep in mind. So the take-home point for that is just because you have imaging that was normal, if you feel something or something new comes up, you need to go back in. And the final point I would say is that sometimes people feel that the screening mammogram, that they can get that for free because that's covered on their insurance, right? But a diagnostic, meaning we're going to need to take additional images, that often will happen. So sometimes people are coming for their mammogram and don't say that they have the symptoms because they want their covered free mammogram. Do not do that. Please do not do that. Because we, the radiologists who are sitting in the back room, are carefully evaluating these images, and we're getting different images as needed. Okay. So the more information we have, the better it is.
That's good. That's good.
Okay. Yeah, that was really good because a lot of those things I wasn't aware of. So thank you.
Start doing those self-care health checks at home, because that really will make a difference, because early detection is what's key. That's what's helping to save lives. Thank you so much, Chanel.
All right, thanks.
All right. Bless you.
Bye.
Okay. That's some good questions roll in here. Now, one of the things we didn't talk about is breast cancer among men. There's a myth that men don't get breast cancer. Oh, yes, you do. Now, what is it? It's very low. Is it 1%?
It's
It's only 1%.
Yeah, 1% or less.
Or less, 0.9%. But hey, you want to make sure you don't fall in that 0.9. Okay, so of that, let's just say 1%. We'll round up. What is that survival rate of that 1%? Is it
Well,
pretty high?
so if a man gets breast cancer,
Uh-huh.
we're looking a lot more closely, is there a genetic factor? Because we know that
Oh.
that's rare.
Uh-huh.
And it's not always that there's mutation, but we're going definitely into the family history. What about his grandmothers? What about his mother?
Oh.
What about his sisters?
Different, yeah.
So we're looking at that. The other thing with men is that men don't want to come into a
They don't go to the
Right.
doctor
Yeah.
at all. They don't go for prostate screening.
Exactly.
Because that's a good point. I'm sitting in my
That's true.
row. We're all waiting to be examined. I don't
Exactly.
see any men sitting in there.
Exactly.
So where do they go?
Well, that's the thing. So if they feel something, so a man often has, I can think of a situation years ago where a patient, it was a breast surgeon and he had a story, that finally he came in and we're looking and saying, this looks abnormal. And he's like, oh no, I was moving a refrigerator and the door closed. I mean, that's what this is. And it's like, that doesn't, the refrigerator door should not cause something that looks like this. So that
Denial.
Also denial. And some of the I sent you some examples of some notable men who've had breast cancer.
That's right.
And some of those men just talk about just the feeling of disbelief or shame. How
Shame.
could this happen to me? I'm a man. So that's also something to keep in mind. But men should not be having regular screening mammograms. It's different if they've had breast cancer, then that's different and can be discussed with their physician. But a man is going to come in because there is a problem. So women get annual screening mammograms.
Right.
Men, we want men to come in if the problems are the same as what we discussed for women.
Oh, really? Okay, so they're always off the hook.
They're off the hook.
Oh my God, we gotta do everything. Okay, all right. Now that's a good clarification there because I didn't quite understand. I have heard of a few men, and you sent me that list too. Very short list of men. Yeah, and most of them are survivors, I believe. I think just one had passed away. Okay, good point. So yeah, we talked about some of the treatment options. Is there anything that does it depend on what? I guess it does depend on what type of breast cancer you have.
It does.
Recommend.
And what I'm very curious with you. What was the most difficult part of your treatment journey?
It was a lot. The most difficult part was doing it alone, I would say.
By yourself.
And that was the chemo was the hardest.
Okay.
It was, I can't remember exactly the name of the drug they gave me. It was after the chemo. I had to go back the day after, 24 hours later, to get this shot in my abdomen.
Oh my
goodness. To build up my immune system because the chemo I was on a lot of chemo. And the shot felt like just a lot of bees just stinging you.
Oh,
and you have to be still. You can't move.
You can't move.
But they can stop. They will stop if you can't take it. They say, can I just give me just a second? And they'll give me a moment to get myself together. But they have to keep pushing it, right? And they can't pull out. That to me was the hardest part. And then also the neuropathy. Not being able to feel my hands and my feet and falling down the stairs a lot, like slipping down the stairs, like that to me was like one of the hardest moments. Because I would never know if I'm at step 1 and step 2 because I can't feel anything in the bottom of my feet.
Oh my goodness.
Yeah, that was.
And did you work throughout your treatment? Okay.
I worked. I had FMLA. I had everything, but I never used any of it. The only time I took off was when I had surgery. But I worked during the whole treatment. I was in the chair.
Well, how did you drive?
Conference hall. I drove myself.
You drove yourself? Oh, bless your heart.
Wow.
Yeah.
Miss G,
Yes.
please explain neuropathy one more time for the listening audience.
Neuropathy is when it's numbness of your hands and feet. You cannot feel your soles of your feet or the soles of your hands.
Wow.
Very numb. Like you don't have like fingerprints.
That's
the tip
it.
of your fingerprints.
Wow.
And there are other diseases that cause neuropathy, diabetes. So there can be diabetic neuropathy as well. And that's why people with diabetes, they often don't know if they have something wrong with their foot because they can't feel it.
Right.
And so on and so forth. But yeah, so chemotherapy, radiation, we know that these are very strong medications.
Yes.
They are.
These are very strong because we're trying to kill the cancer. And when I say we, my colleagues in medical oncology and radiation oncology who are brilliant, that is not what I do. My job is my colleagues and I, is to find the cancer. But then the treatment is with our other colleagues. But yeah, the treatments, they have come a long way.
Yeah.
They have come a long way, and we now have 21-year survivors, 30-year
Yes.
survivors. So
Yeah.
they've come a long way. But with that being said, they can be significant.
Yeah.
It's a
Mhm.
significant journey
It is.
to be treated for cancer.
And it really is. So I always have a hard time understanding, like, how come sometimes some people who have it go into remission and others don't? Like, or sometimes when it does go into remission, it comes back. Like, what causes it to come back after all that cancer treatment and all of that?
Sometimes it comes back in a
It,
different
it,
place.
it comes
Yeah,
back a different
type of
place
cancer.
or more aggressive.
Right.
So
Yeah.
what is there a cause for that? Or it's just
Well,
cells
so
and-
it's there is a cause, but do we know that cause? No,
No.
we do not fully know that
Oh,
cause. And
wow.
the best way I can explain it to people is this. Why do some people get freckles and some don't?
Oh, DNA.
Yeah. Why do some people get moles and some don't?
Oh, girl, I got them all on my back.
Yeah. And most
true.
moles are not cancer, right?
That's true.
Right.
And even most moles that change aren't necessarily going to be cancer. Again, I'm not a dermatologist, so get with your
she's-
dermatologist.
Cardiologist, dermatologist. She's a triple. See?
But it can happen.
Yeah.
It can happen. So most people, and it depends. The overview though is so the stage, and what I like to tell patients is stage starts with an S. So stage is a fancy way of saying spread. Okay.
Mm.
Stage is just a very fancy way of saying spread.
Break it down,
Okay.
girl.
Yes. So what is the stage? Is like saying where has it spread?
Mm.
And there are tables that are used throughout the country, throughout the world, throughout the developed world. And there are certain things that are looked at, the
Mhm.
size of the tumor, the lymph nodes, has it spread,
Yeah.
and it gives us a certain stage. So, and the stages can go all the way from stage 0 up to stage 4.
4. Okay.
Okay.
Mm.
So the higher the stage at diagnosis, the more possibility for recurrence or for an aggressive tumor. So
Gotcha.
that as the stage, which is spread,
Mhm.
as the stage increases, the survivability can
Decrease.
decrease.
Okay. Decrease.
And that's why we want patients to be diagnosed early.
Early detection.
Early detection.
And then what's the sort of general timeline that it does move in between those stages? Is there like 6 months? It could be 6 months, or it just depends.
It just
It
depends.
depends. Okay.
It just depends.
Wow.
So I have seen it's rare, but I have seen over the 14 years, I've seen patients who we have diagnosed with a cancer, and let's say it was a stage 0,
Mhm.
meaning it was a ductal carcinoma in situ, who said, "I'm not going to do anything about this. I'm just going to wait." And that is rare, and that is not what is recommended. But at the end of the day, it is always the patient's choice. I've seen patients that waited for years, and then all of a sudden, it just spread.
Ooh, oh goodness.
So maybe they went year 1, year 2,
Yeah.
year 3, and it was fine, not fine, but it was stable. And then all of a sudden the next year or the following year. So there is not necessarily where we can definitively say, oh yeah, this is this stage, so don't worry about it. We know it's not going to
I
spread.
gotcha.
The science is not there where we can say with each individual tumor the exact characteristics and what it is going to do. We can say what it typically does, but we don't know for sure what this tumor is going to do.
Oh, wow. So just to give yourself a peace of mind, just go and get the treatment. Well, first go and get your annual screenings. And then if they do find something, just take the doctor's orders and recommendations and go get your treatment, because you're right. There's no guarantee that it's not going to spread. So yeah, I mean,
And look at you. I mean,
Yeah,
you're
see?
a great example.
yeah.
You were diagnosed under 40. You went in, you got the treatment.
Exactly.
This is during COVID, so you were
Yeah.
doing this by yourself.
Yes.
And look, and then look, she's smiling.
Yeah.
A walking miracle right here.
Yeah, she's
Pure
smiling.
joy. Like,
I know,
Yeah.
pure joy.
pure joy.
Because you said, I choose life.
Yeah, I choose life.
Yeah. That is just beautiful. What a powerful testimony. And the fact that you went through all this, well, God was with you, but
Oh,
like,
yeah.
you didn't really have family and friends pulling you through. That's tough.
Right.
Yeah, a lot of people probably would have given up.
It was challenging. And then another thing too, when you said what was the worst experience I had with it as well is with the chemo, the nausea, like not being able to eat. I
You
never
vomiting?
regurgitated. I never
You
did
didn't
that.
vomit?
Mm-mm. The steroids helped me with that.
Oh.
But the sickness of not being able to eat.
Eat.
But hungry. Or then when I was able to eat, then I was like, all of a sudden my taste buds just went away. Like, oh my God, I can't taste the food anymore. Like things like that. You never knew what was going to happen next. Like it was just, it takes you through a journey of just different things, but you lose everything, but you get it all back.
But then you gain a lot.
back.
Some people gain double D. You know?
Yeah.
You got a little bigger up here. Well endowed, huh, girl?
Well, and legislation was passed years ago that guarantees that if a patient needs to have whatever type of surgery she has, that the reconstruction, that should be covered by insurance as
Yeah,
well.
it was.
So that should be covered. So for patients who, and we've heard both stories, some people have, they will call it a lumpectomy. That's just a fancy way of saying we're going to remove just a piece. Okay. Or there's a mastectomy. That is just saying they're removing the entire breast. But with either of those, there can be reconstructive options. Those reconstructive options also include looking at the other breast because patients want to have symmetry. Patients want to have symmetry. There are various types of reconstruction that can be done. They can use implants, or they can use your own tissue, or they can do it at the same time, or they can delay, or and it's not a one size fits all. But I do think I'm glad that you mentioned the surgery you had. We've had people call in who said no, they had a mastectomy, but for either one and anything along that spectrum, if your insurance has covered your cancer treatment, it also covers those reconstructive surgeries. And if there are complications later with that reconstructive surgery, then it covers that. Now, I do quickly want to say, I think the thing I'm asked about just as much as breast cancer is breast implants. I am
now we're on breast implants.
Yeah, well, I'm just saying, people ask me about breast implants all the time. So I do want to just make sure I'm very clear and say this. If insurance did not pay to have your implants placed, they will not pay to change them, fix them, or anything that happens to them. That's a distinction that I want to very clearly say. But that's different than if you were diagnosed with breast cancer. Then they pay. Yeah.
But if breast implants, it's not like it's
not for cancer patients.
Okay. I know that. Yes, hi caller. Thank you for calling to the show. Who are we talking to?
Hi, how are you? My name is Amani Haley. Can you hear me?
Yes, ma'am. Hi, Amani. How you doing?
I'm doing good. I do know Dr. Robinson from our Jack and Jill group, and she is lovely.
No, Jill together.
I'm not a patient. I'm just a friend from the group, but I do have a question.
Yes.
My dad's side of the family has a lot of cancer. You name the cancer, they've had all kinds. And I have my mammograms regularly, and thank God, so far everything is always normal. But does that put me at a higher risk for any type of cancer? And what should I do now besides getting my regular annual physicals and exams?
I love that. That's a great question, Amani. Mother Haley, since we're in Jack and Jill together. So there are what we call high-risk geneticists, okay? So at UTMB, we have a high-risk geneticist. And so what they do is, so if a patient starts telling me, similar to what you're saying, well, I've had multiple people in my family who've had breast cancer, or, I've had multiple biopsies, even though they were negative, but why did I need so many? We will refer them to that clinic. And what they do, Amani, is they look at what we call a nomogram. So essentially, they're going to ask you lots of questions. What age when you first started having your cycles? How many biopsies have you had? Who in your family had what cancer and at what age? And they're putting this information into a database. And then it's going to give a number. And that number, if that number shows that you have over a 20% lifetime risk of breast cancer, then in addition to getting mammograms and possible ultrasounds, you also typically need a breast MRI. They will also go over other preventives. So we know that for some people, certain cancers run together, breast and ovarian, for example. Wow. So if you were to say, well, my grandmother had ovarian cancer, that's going to raise more red flags. And they also look into, does a patient need to be tested for some of the genes that run with breast cancer? So there's the BRCA1, which stands for breast cancer 1 gene, BRCA2, breast cancer 2 gene. But now everybody's doing all of this DNA, 23andMe and everything else. So there's actually additional genes we're starting to find that increase the rate of breast cancer. So yes, what you can do is meet with a high-risk geneticist. I suggest having a very detailed, go through your family history prior to that meeting. Like, start calling your family members and saying, okay, what age was so-and-so when they had cancer? Do we know what type of cancer? And even saying, sometimes people will say, well, they had brain cancer. Did it start in the brain or did it travel to the brain? Because those are two things. So going through and knowing that and making that appointment, they can tell you very well your best next step, and do you need to be taking other preventative, maybe getting colonoscopies earlier than everyone else, or do you need to, what are other things that they need to look at?
Oh, that's good.
Okay, that's helpful. Thank you.
Thank you.
Thanks, Amani.
God bless you.
Thank you. God bless y'all too. This is very helpful. Y'all have a good night. Thank you.
Good night. Well, I might need to do that ancestry.com and look at, take a deeper look at family history, because you're right. All that stuff that's going on. I didn't know there was linkage between those two cancers, cervical and breast cancer. Ovarian, not cervical.
Not cervical.
Okay, that's
two different things.
Two different things. Girl, educated me. I'm glad that's not one of them, though. I'm glad it's not both. It's
that's true.
ovarian.
Yeah, okay. And again, we just know there's a link, and often that link is going to be in patients that have one of those breast cancer genes. But we know that ovarian and breast can run together in some patients.
So what about, we talked about risk factors, and I know we'll need to wrap up soon. What about women who are taking like hormone therapy, or they don't want to get pregnant, so they're taking birth control. Is that sort of igniting some things too? So
let me say, and being in that perimenopausal
she doesn't look it. You don't look a day over 30, girl.
But I definitely am. And so let me already speak up before any woman calls in.
They'll be blowing up.
Well, before they say, do not take me off my HRT, my hormone replacement therapy. So we do know there were trials that looked at HRT, hormone replacement therapy, and the people who were taking it, people who are not. And there is a slightly increased risk of breast cancer. But with that being said, it's a small increase. And patients can have significant perimenopausal or menopausal symptoms, and it can be awful. Like, it can be debilitating for them. So with that being said, you want to make sure you've had a regular mammogram and you're doing the exams routinely. But now, if they find something, if someone says they feel something, okay, then they're going to say, well, wait, with this HRT, we may have to hold off and see. But, we have to balance quality of life as well.
That's true.
If somebody's having complete brain fog, hot flashes all the time, they can't sleep, they can't think, that's a lot.
It is.
That's a lot. So it's a balance. And again, I'm going to throw this out there. I don't prescribe HRT. Those are for my colleagues.
Okay, we got 4 now.
OB-GYN. Yeah, I'm not an OB-GYN.
Doctor of all trades.
Yes,
Jack of all
no,
trades. Lord
no,
have mercy.
no.
But you sure know a lot about
Yes.
so many of these different areas. My goodness. I don't think I've ever met a doctor who can talk about all these different crossovers, all these different areas.
It's our wheelhouse.
It's your
That's our
own.
wheelhouse. And we, I will say, at UTMB and at most academic medical centers, they have what they call a tumor board. So what we have is breast experts that we all sit together. So my colleagues and I will sit speaking about breast radiology, and someone from medical oncology will speak radiation oncology, plastic surgery, breast surgery, and what is going to be the best plan of care for this patient.
Okay.
So all of these nuances and, well, she's on this, or what about this, or he's on this, or they have a family history of that. So all of those nuances are discussed, and we have tumor board on a weekly basis with multiple patients being mentioned. So, over the years, you've seen and heard a lot of scenarios.
Gotcha. Yeah. So you're just absorbing all of that. Wow, you're full of knowledge. My goodness. Bless the heart. Well, we're going to wrap up. But before we get to the available resources, I got to ask you a quick question. How do you deal with your mental health? I mean, you're dealing with all of this and sick patients, and you bond with some of them. They pass away. Like, you've got family and husband, children. How are you managing your mental well-being?
I think that's a very good question that's often neglected. I have thought about this over the years. I have literally told hundreds of patients, I'm so sorry, but this is a breast cancer. And I have to realize that my role is to relay the information in as a kind of a manner as possible. I can pray for patients. I can be at peace with that situation, but I don't decide who lives and who dies. That is not my personal decision. And I think it's also helpful. Many patients are so grateful. They're just grateful that it's been found. So even though they're sad, but they still are like, thank you. Thank you. And if you see them later, they're often like, thank you. And then they say, do you remember? Remember you diagnosed me? Remember?
Do you remember all your patients?
No.
Don't be running up to her at 18. No, she don't remember all y'all. And you can't. You've got hundreds and thousands of patients.
Yeah, but I think that in terms of, I do think for physicians and for patients, we have to know that we can sleep well at night as a patient and as a physician when we say, I did everything that I could do. When we can say with all certainty, I did everything that I can do. We're all human, but we are doing our best, and there's grace. There's grace.
That's true.
So, but with that being said, I always listen. I appreciate any patient. Sometimes patients will say, "Well, I'm praying for you." I'm like, "Please, thank you."
Yeah, you need it.
Yes.
Oh my gosh, like you might get PTSD or something. Girl, well, see, that's why God didn't call me to be a doctor. I'd probably just be crying all over the place. I know, I take it home. I don't, you guys, God bless you. I mean, you got to have mental strength. That's tough. Woo.
Well, really, kudos to the
with you guys
survivors.
too, the survivors too. And you're a survivor too. When you take up, you have to deal with a lot too, but you definitely, my gosh, bless your heart. You've been through a lot. And you're still standing. You're still here.
Surviving and thriving.
Listen, the doctors have the medicine, but God has the power. So let's wrap up with the available resources. We're going to put the phone number of where you guys can go if you want. Some more information, please do. And it talks about, you get some information, on your insurance coverage and what you can do if you're uninsured or underinsured. That's a good roadmap, right?
Absolutely. I just want, we want to make sure that it's 2025. We don't want patients to be going without resources due to lack of insurance. There should be no shame if you do not have insurance. There's a lot of different reasons that can happen, but we do offer free mammograms for uninsured patients. It depends on this situation, and there may be information that you have to fill out, but please call that number, 266-1888. We also partner with wonderful people in the community. There are many philanthropic donors that have given to us. There is a Broad Dazzle. Actually, Sheriff Jimmy Fullen and his group have raised $20,000 that they gave us in October for uninsured patients. The funding is there. We just, and this is why we do this, because we want to make sure that we're reaching all of the patients. So that is what we can offer.
Oh, wow. Yeah, that is good. I love that. And that helping people to feel empowered. Because if they don't have family helping them, I mean, people may just give up and say, I can't do it.
Yeah.
So I'm so glad we did this show. I'm hoping even we just reach one person to go get their mammogram, their screening, tomorrow. Hey, we've made a difference. We've made an impact. What would you say to someone who just got this dire news? What would be your advice to them?
My advice to them would be to be prayerful, to also associate yourself with positive people, and know that there is hope for tomorrow. And this, there's different types of avenues you can reach out to, like Can Care. I'm also a volunteer with Can Care, but I talk to patients all around the world through their cancer journey. So there is help out there. Seek that help. And know that you're not in this journey alone. There's someone that can walk the journey with you, and the resources are there.
Amen. Well, any other final words that you want to leave with our audience?
I'm just very thankful. I feel very blessed to be in this position. I'm very thankful to all of my wonderful colleagues at UTMB, and most importantly, I'm thankful to God for getting for just being blessed to be able to do this. To all the patients that have allowed me to walk a portion of their journey with them, I thank you. I thank you. I love what I do.
Yes, and so do we.
It shows.
It shows. I know, and that's definitely your calling. I mean, not just your intellect, but the fact that you've got such a big heart and that you really care about people. That is so touching. I'm gonna cry, but I can't. Can't do it. I love it.
Coach Rowe, Coach Rowe, before we close out, please encourage the listening audience to get their free mammograms. One more time.
Go ahead.
Please get your free mammogram.
Yes. You heard the doctor's order.
Yeah. If you don't have insurance, please call that number again, 409-266-1888. There may be questions you need to answer. There may be something we need to do. Is it going to work for every single patient? Maybe not, but the majority, there's usually something we can try to do. So please call that number.
Yeah. Amen. Thank you for that, producer. So Breast Cancer Awareness Month is in October, but we can't get complacent and just talk about it only one time a year. It has to be perpetual. It has to be ongoing. We have to be advocates, and we can't just do that once a year and sit on the sidelines. We've got to have some skin in the game. The myth of not getting breast cancer because of no family history or because you don't have any pain in your body have been dispelled. Thank you, Dr. Robinson. Early detection is key and can increase your chances of survival. It can be fearful to get a negative diagnosis, but the good news is that with the advanced medicine, technology, and treatment plans, you can still have a qualitative life. Just look at our beautiful sister sitting to the left of me. That's proof.
Yes.
Keep hope alive. God is bigger than breast cancer and any other disease. He is a miraculous healer. So keep the faith, hope, and trust in God, and He will make all the difference in your life. So happy New Year and happy new you. So thank you guys for tuning in. Thank you for all your wonderful questions. But don't disconnect now. Go ahead and call that number or get, and was there a website that they can go to as well?
Well, when they call the number, they'll get more information.
Okay, and then you'll go to the website, get more information, and don't just tune out because you heard a great conversation. You've got to apply this knowledge, apply this information, and do something with it. Even if it's not for you, share it with someone else. Share it with someone else. Thank you guys. It helps somebody. That's it. Well, thank you for tuning in. Thank you for following me on Facebook, LinkedIn, and all the social channels. I love you guys, and be sure to love yourself, and I'll see you next time. Thank you.
1, 2, 3, 4.